Introduction. Childbirth is one of the most intense and life changing experiences a woman can go through. It marks the beginning of a new life, but also involves significant physical and emotional challenges. One of the most widely discussed aspects of childbirth is the pain that comes with labor and delivery. A common claim states that the pain a woman feels during childbirth is equivalent to breaking 20 bones in the body. This comparison is often used to emphasize the severity of labor pain. But is it scientifically accurate? Understanding labor pain requires examining its causes, intensity, and how it compares to other types of extreme pain. This discussion will explore the reality of labor pain, how it is measured, and whether or not it truly compares to breaking multiple bones. Additionally, we will look at medical perspectives, pain management options, and common misconceptions surrounding childbirth pain. The physiology of labor pain. Labor pain is primarily caused by the intense physical changes a woman's body undergoes to deliver a baby. It is a complex experience influenced by various physiological processes, including uterine contractions, cervical dilation, and pressure on surrounding organs and nerves. A. Uterine contractions. The uterus is a powerful muscle that contracts to push the baby down through the birth canal. These contractions cause the muscles to tighten and then release, gradually opening the cervix. The pain results from the stretching of the uterus and the pressure on surrounding tissues. B. Cervical dilation and effacement. The cervix must stretch from a tightly closed position to about 10 centimeters to allow the baby to pass through. This stretching and thinning of the cervix, effacement, can cause sharp cramping pain. C. Nerve and pressure pain. As the baby moves downward, it presses on nerves, including the sciatic nerve and pelvic nerves. This can cause intense pain in the lower back, hips, and legs. Hormonal influence on pain perception. Hormones like oxytocin trigger contractions, intensifying labor pain. Endorphins, the body's natural painkillers, are released to help manage pain, but their effectiveness varies from person to person. Overall, labor pain is a unique type of pain, different from injuries like bone fractures. It involves muscle cramps, nerve pressure, and tissue stretching, making it a complex experience that varies from woman to woman. Measuring pain, subjectivity, and science. Pain is a complex and subjective experience, making it difficult to measure and compare accurately. Labor pain, in particular, varies greatly among women due to differences in pain tolerance, physiology, and emotional factors. However, scientists and medical professionals use several methods to assess and quantify pain levels. A. Pain scales. The Numerical Pain Rating Scale, NPRS, asks individuals to rate their pain from 0, no pain, to 10, worst possible pain. The McGill Pain Questionnaire evaluates different dimensions of pain, including sensory and emotional aspects. The Visual Analog Scale, VAS, allows patients to mark their pain level on a continuum from mild to severe. B. Comparing labor pain to other types of pain. Some studies suggest that labor pain ranks among the highest levels of pain experienced by humans. Common comparisons include kidney stones, often compared to labor in intensity but shorter in duration. Severe burns, considered one of the most excruciating types of pain, though different in nature. Bone fractures, painful but typically less sustained than labor. See challenges in measuring pain. Pain perception varies due to genetic, psychological, and environmental factors. Some women experience quick labors with manageable pain, while others undergo prolonged, intense pain. Hormones like endorphins, natural pain relievers, can reduce perceived pain levels. Because pain is so personal, it is challenging to make absolute comparisons, such as saying childbirth pain is equal to breaking 20 bones. However, it is widely recognized as one of the most intense types of pain a human can experience. The breaking 20 bones claim. The idea that childbirth pain is equivalent to breaking 20 bones is a popular claim, but is it scientifically accurate? While labor pain is undeniably intense, pain perception is complex and varies from person to person. This section examines the origins of this claim and whether it holds up under medical scrutiny. A. Origins of the claim. The breaking 20 bones comparison is often cited in discussions about labor pain, but there is no direct scientific study supporting it. It likely originates from anecdotal reports or attempts to emphasize the severity of labor pain in relatable terms. Pain comparisons are difficult to quantify because different types of pain, e.g., acute fractures versus prolonged labor, activate the nervous system differently. B. Comparing labor pain to bone fractures. Bone fractures cause sharp, immediate pain due to the breaking of bone tissue and activation of pain receptors. Labor pain is different. It builds over time, involves muscle contractions, nerve compression, and tissue stretching. While both can be excruciating, fractures result in localized pain, whereas labor pain affects the entire lower abdomen, back, and pelvic region. C. Scientific perspectives on labor pain. Studies show that labor pain can reach extreme levels on pain scales, often ranking as one of the most painful human experiences. Some researchers compare it to kidney stones or severe burns rather than bone fractures. The release of endorphins and oxytocin during labor can alter pain perception, something not present in traumatic injuries like fractures. D. Conclusion: fact or exaggeration? While labor pain is among the most intense types of pain, the claim of equal to breaking 20 bones is more of a dramatic analogy than a proven fact. The experience of labor pain is unique, involving prolonged discomfort, contractions, and emotional factors that make direct comparisons to physical trauma difficult. Rather than focusing on numerical comparisons, it's more useful to acknowledge the incredible strength and endurance required to go through childbirth. Medical perspectives on labor pain? Doctors, midwives, and pain specialists view labor pain as one of the most intense forms of pain a person can experience. However, it is unique in that it serves a physiological purpose, helping the body deliver a baby, unlike injury-related pain, which signals harm. A. How medical experts describe labor pain. Labor pain is described as a combination of muscle cramping, intense pressure, and nerve pain. It progresses in stages. Early contractions may feel like strong menstrual cramps, while later stages involve sharp, intense waves of pain as the cervix dilates and the baby moves down. The transition phase, when the cervix reaches full dilation, is often considered the most painful part of labor. B. Pain variability among women. Some women report excruciating pain, while others describe labor as manageable or even empowering. Factors affecting pain perception. Genetics. Some people have higher pain tolerance. Hormonal differences. Endorphins can naturally reduce pain perception. Emotional state. Anxiety and fear can heighten pain, while relaxation techniques can help manage it. Previous births. First-time mothers may experience longer and more painful labors. C. Comparing labor pain to other medical conditions. Kidney stones, often compared to labor pain, but typically shorter in duration. Migraines. While not as physically intense, migraines can cause extreme suffering for extended periods. Severe burns, considered among the most painful injuries, but different in nature. D. Role of medical interventions. Epidurals numb the lower half of the body, significantly reducing pain. IV pain medications provide some relief but do not eliminate pain. Natural pain relief methods. Breathing exercises, water births, and massage can help manage discomfort. Conclusion. Medical experts acknowledge that labor pain is among the most intense types of pain, but they emphasize that it is temporary and purposeful. Pain relief options and mental preparation can greatly impact a woman's labor experience. Would you like more details on medical pain management options during labor? Managing labor pain is a key concern for expectant mothers, and there are various methods available, ranging from natural techniques to medical interventions. The effectiveness of these methods depends on individual pain tolerance, labor progression, and personal preferences. A. Natural pain management techniques. These methods do not involve medication, but can help reduce pain perception and promote relaxation. Breathing techniques. Controlled breathing, e.g., Lamaze or pattern breathing, can help manage contractions. Movement and positioning. Walking, squatting, or changing positions can ease discomfort and help the baby descend. Water therapy. Taking a warm bath or using a birthing pool can relax muscles and reduce pain. Massage and counterpressure. Applying pressure to the lower back can help alleviate pain. Hypnobirthing, a method that uses relaxation and visualization techniques to manage labor pain. B. Medical pain relief options. For those who prefer or require additional pain relief, medical options are available. Epidural anesthesia, a common and effective option that numbs the lower half of the body, provides significant pain relief but may slow labor in some cases. Spinal block, similar to an epidural but used for shorter procedures like C-sections, provides immediate pain relief but lasts for a limited time. Opioid pain medications, e.g., fentanyl, morphine, administered through an IV to dull pain but do not eliminate it completely, may cause drowsiness or nausea in both the mother and baby. Nitrous oxide, laughing gas, helps reduce anxiety and pain perception. Less effective than an epidural, but provides some relief without major side effects. Alternative and complementary methods. Some women prefer non-traditional approaches to labor pain relief. Acupuncture, stimulating pressure points may help ease pain. Aromatherapy, essential oils like lavender or peppermint can promote relaxation. TENS, transcutaneous electrical nerve stimulation, a device that sends mild electrical impulses to reduce pain signals. D. Choosing the right pain management strategy. The decision depends on personal preferences, medical conditions, and how labor progresses. Some women choose natural childbirth, while others opt for medical interventions. A birth plan can help communicate pain management preferences to healthcare providers. Conclusion. There is no right way to manage labor pain. What works best varies for each woman. The goal is to ensure a safe and positive birth experience with the appropriate level of pain relief. Labor pain is not just a physical experience, it also has significant psychological and emotional components. A woman's mental state, emotions, and support system can influence how she perceives and copes with pain during childbirth. A. The role of fear and anxiety. Fear can intensify labor pain by increasing muscle tension and stress hormones. The fear-tension-pain cycle suggests that fear leads to tension, which makes contractions more painful. Women who are well-informed and prepared often experience less fear and better pain tolerance. B. The impact of hormones on pain perception. Oxytocin, known as the love hormone, it strengthens contractions but also promotes feelings of bonding and well-being. Endorphins, natural painkillers released by the body to help manage pain. If fear is high, adrenaline can slow labor and make pain feel worse. C. Emotional support and its effect on pain. Having a strong support system, partner, doula, family, or medical team, can reduce anxiety and increase pain tolerance. Studies show that continuous support during labor leads to shorter labors, fewer medical interventions, and a more positive birth experience. Words of encouragement and reassurance can help women feel more in control. D. Mindset and preparation. Women who approach labor with confidence and positive expectations often report lower pain levels. Childbirth education classes help mothers understand what to expect, reducing fear and anxiety. Meditation, visualization, and mindfulness can help shift focus away from pain. E. The emotional high after birth. Despite the intensity of labor pain, many women experience an emotional high immediately after birth. This is due to a surge of oxytocin and the overwhelming joy of meeting their baby. Many mothers describe labor pain as temporary and forgettable compared to the happiness of holding their newborn. Conclusion. The psychological and emotional aspects of labor pain are just as important as the physical. A positive mindset, emotional support, and relaxation techniques can all help a woman cope with the intensity of childbirth. Would you like more details on any of these aspects? Labor pain is often described as one of the most intense types of pain a human can experience. However, pain perception is subjective, and different types of pain activate the nervous system in different ways. This section compares labor pain to other extreme pains, highlighting similarities and differences. A. Kidney stones versus labor pain. Kidney stones cause severe cramping as the stone moves through the ureter. Like labor contractions, the pain comes in waves but can last for hours or days. Many people who have experienced both say that labor pain is more intense but has a purpose, while kidney stone pain is purely distressing. B. Severe burns versus labor pain. Burns are among the most painful injuries because they damage nerve endings. Burn pain is constant and often worsens during treatment, unlike labor pain, which comes in intervals. Unlike childbirth, burn injuries don't have a natural relief point, such as delivering the baby. C. Bone fractures versus labor pain. Breaking a bone causes sharp, immediate pain, whereas labor pain builds over time. A broken bone affects a specific area, while labor pain is widespread: abdomen, lower back, and pelvis. Some argue that a single fracture is less painful than labor, but multiple fractures could compare. D. Migraine headaches versus labor pain. Migraines involve severe, throbbing pain that can last for days. Unlike labor, migraines don't have a clear endpoint or relief process. While migraines may not be as physically intense, they can cause extreme suffering. E. Gunshot wounds versus labor pain. Gunshot wounds cause sudden acute pain, while labor pain builds gradually. A gunshot wound's pain is influenced by factors like location, nerve damage, and shock. Some trauma victims report that labor was worse because of its prolonged nature. Conclusion: labor pain is unique because it is temporary, purposeful, and often followed by relief and joy. Unlike injury related pain, it is not a sign of harm, but rather a natural process. While comparisons help put labor pain into perspective, every person's experience of pain is different. Would you like to explore any of